Managing severe infection in newborns when referral is not possible. Young babies with signs of severe infection are best cared for in a hospital. However, for many families in poor countries, reaching a hospital is not possible. There are now simplified antibiotic regimens that provide effective treatment outside the hospital when referral is not possible. This video reviews 5 key signs of severe infection and treatment guidelines when referral is possible and when it is not. In every visit with a sick baby, routinely check for each of the 5 major danger signs. Not feeding well is the first danger sign. Observe the mother feeding her baby. The baby who is not feeding well sucks less or poorly or not at all. He may not open his mouth when offered the breast, or he doesn't act hungry. He may not wake up to feed, or he sucks weakly and doesn't stay awake long enough to empty the breast. Here, we compare a healthy baby. She is alert and suckles eagerly at the breast. Movement only when stimulated is the second danger sign. This baby appears sluggish and drowsy. Try to wake the baby by clapping or rubbing a foot. Notice that the baby doesn't wake up easily. Now, gently jiggle the baby. He wakens only briefly with this stimulation. Here, we compare a normal sleeping baby. When we try to wake him, even just by clapping, he reacts normally by fussing and crying. And then he stays awake. A baby with signs of severe infection only moves when aroused, or he doesn't move at all. A cold body temperature is the third danger sign. A body temperature measuring less than 35.5 degrees is dangerously low. If there is no thermometer, compare the baby's body temperature to your own. If the baby's feet and belly are cold, the baby is too cold and may be very sick. Warm the baby quickly through skin-to-skin contact on the mother's chest and cover them with blankets. If after the baby is warmer, he still looks unwell, this is a danger sign. A hot body temperature is the fourth danger sign. A body temperature measuring greater than or equal to 38 degrees is too high. The baby's body will feel hot to touch compared to your own body. The mother may report that the baby's mouth is hot on her breast, and the baby's face and body may look flushed. Cool the baby off by removing his clothes briefly. If the baby is still too hot or looks unwell, this is a danger sign. Severe chest indrawing is the fifth danger sign. Watch the baby's chest and abdomen closely. Notice as the baby takes a breath, his lower chest sucks in and the belly appears to move out. Babies with breathing problems often have chest indrawing and fast breathing occurring together. Compare a baby with normal breathing his chest moves out when he takes a breath. In contrast, when the baby with chest enjoying takes a breath, his lower chest draws in and his belly appears to move out. A baby with any of the 5 signs of severe illnesses needs to be referred right away to a hospital. Give the first doses of antibiotics before the baby leaves. These babies will need intramuscular injections of ampicillin and gentamicin. Notify the facility, write a referral note, and arrange transportation. Make sure the baby is fed often and kept warm through skin-to-skin contact throughout the trip. Every effort should be made to refer the baby to a hospital. If the family does not accept to go or cannot get there, do your best to care for the baby in the community, though realize this care is not the same. Treat the baby according to your national guidelines with one of 2 regimens. The preferred option is amoxicillin by mouth twice daily for 7 days, plus IM gentamicin once daily for 7 days. Check the baby at each daily visit to be sure he's gradually improving. The second option is giving amoxicillin by mouth twice daily for 7 days, plus IM gentamicin once daily for just 2 days. See the baby on day 4 to determine if the baby is improving. Advise the mother to give only breast milk every 2 to 3 hours and keep the baby warm. Counsel her to return to the clinic immediately if the baby's condition worsens. Be aware of circumstances that put the baby at great risk. Signs of critical illness, such as seizures or persistent vomiting occurring during the 7 days of treatment. Any new danger sign appearing after 2 days of treatment. Or any of the 5 danger signs still present after completing the treatment. In these cases, try your best to get the baby to a hospital. Remember, routinely check babies for 5 signs of severe infection. Not feeding well, movement only when stimulated, too cold, too hot, and chest indrawing. Refer these babies promptly to a hospital. If referral is not possible, treat the baby with amoxicillin and gentamicin for 7 days according to your national guidelines.